Hey guys, welcome to Podiatry Practice Mastery. Don here. I'm doing the 20 podcast based on the recent AAPPM meeting. This is number 8. These are some elegant questions that I got from the AAPPM seminar. So I think a lot of times we tend to tell patients, this is something that the mistake that I tend to make is I know what they have going on and I say, you have this and you need to do this. Whereas it works better if we ask them how this affects them, meaning when we say it, they don't believe it. But if they say it, it's true. I don't know if that makes sense. But like if I say you have flat feet and you need an orthotic, that's one thing. If I say, how do your feet affect you? Okay? Or how does this affect your life? What activities can you or can't you do? And they're kind of telling me, how much pain does this cause you? How long has this been hurting? So they're telling me how it affects them, and this works quite elegantly. Like I talked about before, if you listen to the other episode talking about braces or balance braces or any other type of brace, if we say, if I have something that could help you be more stable and help you prevent falls, would you be interested in that? Or, would you be interested in reducing your fall risk? So those types of questions, usually it spurs on a yes, versus talking about the brace. So I'm going to do a digress here for a second. And this is something we hear over and over if you ever study any marketing. People they never buy what they're buying. They're buying the result. So the easiest example is if you go to the hardware store and you're going to buy a drill bit. You're not wanting a drill bit. What you're really wanting is a 1/4-inch hole that drill bit is going to give you. So you're buying, what you really want is the result. And so, for example, our patients, they don't want braces. They don't want AFOs. They don't want any of those things. What they want is, do you want to help your stability when you're walking? Do you want to have less pain in your arch and your ankle when you're walking? Like, do you want these other things? Like, what you want to offer them is the result. And this is a change, right? For what we're used to doing is we say, well, you need a brace. Well, why do I need a brace? Or what's the benefit of the brace? We have to kind of have them understand that before they'll do it. And that's like anything, okay? So a couple of the good questions that I found is when we're talking about pediatrics, we talked about that. Like, when you see someone with a really flat foot, let's say they come in with a posterior tibial tendon dysfunction, really flat foot, there's 2 questions you can ask them to get more business, I guess. Who did you give that foot to? Okay, meaning who are their kids, and have them bring their kids in, because if they have a very flat foot, most likely their kids are going to have a very flat foot. Okay, and then who did you get that foot from? Meaning, who are their parents? Like looking at their parents' feet. So that's a way of getting and having everyone come in. What I would like to do, I'm not currently doing it, but when anyone comes in, I'm going to have the other person take off their shoes, and I'll give them a quick little consult or a 3-minute consult about what's going on to see if they would benefit from coming in. That's very common. Have them come back to make an appointment for that. So those are some good questions. Who did you give that foot to, and who gave you those feet? And the other thing is, many patients say, especially with kids, that the kids are going to outgrow, right? The parents will say, oh, you're just going to outgrow this problem, or as you grow, you're going to outgrow it. A better word when you're talking to patients, and this is something I learned at this conference, I think it's all just elegant wording. You're not going to outgrow it. What you tend to do is you tend to compensate. So when patients say, I think I'm just gonna, you're gonna outgrow this. No, what you tend to do is you tend to compensate, and that's a difference. And so when we talk with our patients, we have to let them know that this compensation can cause further problems. So, for example, it's a very, very flat foot. They're going to compensate. That could develop midfoot arthritis. That can develop pain to other areas in the foot, the posterior tibial tendon, things like that. So you're not going to grow out of it. You're going to compensate. I think these kind of wording phrases are quite helpful when we're talking and discussing things with patients. Okay, once again, hope you guys found this helpful. Please send me an email, don@podiatrypracticemastery.com. Let me know other topics, other good wording techniques that you have. And please go to podiatrypracticemastery.com. Get my tool. That's the tool that I use. And there's actually some questions in there. So if you go to the patient presentations tool, within the beginning, I have a certain questions that are actually in the slide deck. And just it makes me not slow. It makes me slow down and actually ask those questions. So try asking those. It takes a little bit of time when you're not used to asking questions to asking more questions. It might slow you a little bit down, but it's going to be a better visit for the patient. Okay, once again, hope that helps. Let me know what your thoughts are. Okay, have a good one. Bye-bye.